Today we are going to talk about global health. Global health means understanding that health is not just personal or local, it's deeply interconnected across borders. In today's world, what happens in one country can quickly affect people thousands of miles away. Diseases travel through international flights. Economic risks affect access to medicines. Climate change weakens health systems. Migration reshapes patient populations. Trade influence food systems. Technology spreads both widely and misinformation. Health is no longer limited by geography, it's a global. In the past, countries mainly cooperated during emergencies. However, global health recognizes that we are permanently interconnected through globalization, travel trade, urbanization, digital communication, environmental change, and political decisions all shape the health of population worldwide. A virus can spread across continents in days. Medical supply chains depend on global markets. Pollution generated in one region affects air quality in another. Today, health challenges are shared challenges.
One of the central principles of global health is health equity. Health equity means that everyone should have a fair and just opportunity to be as healthy as possible. Unfortunately, health outcomes are not equal. Where you are born, your income, education, housing conditions, access to clean water, and even your gender to ethnicity can strongly influence your health. Health is shaped by social determinants, the conditions in which people are born, work, live, work, and age. Hospitals and doctors are important, but they are only one part of the equation. Police, education system, labor markets, and environmental protection all determine health outcomes. Global health seeks to reduce these inequities by promoting universal access to care, fair distributions of resources, and policies that protect vulnerable populations.
Globalization and health. Globalization has transformed how we live and how we experience health and diseases. On one hand, globalization has improved access to medical care, vaccines, and technology. International collaboration has accelerated scientific research and strengthened response to global crises. On the other hand, globalization also increases vulnerability. Rapid travel allows infection diseases to spread quickly. Global trade can encourage unhealthy diet in processed foods, contribute to obesity, diabetes, and cardiovascular disease worldwide. Economic globalization can also widen inequalities. Low-income countries may depend on wealthier nations for medicines and medical equipment. During global crises, supply chains can break down, leaving vulnerability populations without essential resources. Globalization connects us, but it also makes college responsibility more important than ever.
Human health depends directly on the health of the planet. This concept is known as planetary health. Climate change is one of the greatest threats to global health in the 21st century. Rising temperatures, increased heat-related illnesses and deaths. Extreme weather events such as hurricanes, floods, and droughts destroy homes, hospitals, and infrastructure. They disrupt food systems, leading to malnutrition and displacement. Climate change also expands the geographic range of vector-borne diseases such as malaria and dengue. As temperatures rise, mosquitoes spread to new regions, exposing populations that were previously not at risk. Air pollution is another major environmental threat. Pollution from vehicles, industries, and burning fossil fuels contributes to respiratory disease, cardiovascular conditions, and millions of premature deaths each year. Importantly, pollution does not respect borders. Emissions in one country can affect air quality globally. Water contaminations and poor waste management increase the risk of infectious disease. Deforestation and habitat destruction bring humans into closer contact with wildlife, increasing the risk of zoonotic disease infections that jump from animals to humans. The One Health approach recognizes that human health, animal health, and environmental health are interconnected. Protecting ecosystems, protect people's sustainable policies are not only environmental decisions, they are health decisions. People promoting equity and protecting vulnerable populations. Planet ensuring environmental sustainability and climate action. Priorities: identifying urgent health needs and allocating resources fairly. Policy: creating laws and systems that support health for all. Practice: translating knowledge into real-world action.
Understanding global health strengthens the clinical reasoning and broadens our perspective beyond the individual patients. It reminds us that health may be influenced by migration patterns, environmental exposure, economic inequality, or global supply chains. It teaches us to think systemical and ethical. Global health challenge remain us that our future depends on solidarity and shared responsibility by promoting equity, environmental protection, and international cooperation. We can build resilient health systems capable of responding to emerging threats. Protecting global health is not optional, it is essential for sustainable development and human dignity worldwide. Global health reinforces our responsibility as healthcare providers and as global citizens. Climate policies are health policies. Environmental protection is disease prevention. Economic fairness supports well-being. Medicine today is global. Medicine and her responsibility extends beyond borders.